Hi guys, Mike back here. Today we're going to do another video on the coronavirus because apparently there's a lot of misinformation out there, and it's crazy because people for some reason right now believe that by drinking hot water and gargling it down your mouth like you were drinking mouthwash or something for, I think it's 30 seconds to a minute, that the coronavirus will somehow just disappear. That's not true whatsoever. A lot of these things are things that people are making up. A lot of these things, I don't know, are coming from people that are just trying to get views or get attention, but it's not true whatsoever. Now, we've had a lot of stuff going on. The stock market crashing every single day, then going back up, and then going down. According to resources, to the news, to up to the president, we're supposed to be getting some kind of big stimulus package to help bail out lots of companies and giving it back to the working people, which honestly it should be 100% giving it back to the working people, because for the simple fact, most of our states right now, a lot of people can't go to work. We're on lockdown. We can only go to places like the grocery store and essential places. A lot of most non-essential businesses are all shut down right now. So there's no revenue going through anywhere. So hopefully Congress passes the bill for us to get the stimulus package, because it's insane right now. The what's it called? The unemployment rates are skyrocketing right now. People are panicking. People are going absolutely crazy. Now, it's a pandemic. People are absolutely gonna go crazy, and for good reason. But also, I wanted to make this video again because there's a lot of misinformation out there. Now, back to the coronavirus. Apparently, within the next few weeks or next month or so, we could have a couple new outbreaks, or not outbreaks, excuse me. We could have a couple of medicines that could actually, in fact, take this out. Like, it could reverse the effects. It could bring us back into the world that we once knew. I hope that a lot of you guys watch this video, because it is a lot of important information. I'm trying to stay up to date and trying to figure out as much stuff as possible every day. I listen to the radio, I watch the news. So I'm basically wanting to give back to the people, because there's a lot of misinformation out there, and a lot of people are just trying to do things just to get views, and that's totally wrong. Now, excuse me, but yeah, back to what I was talking about. Right now, there's already a few things out there right now that could possibly help the coronavirus. Excuse me again. Sorry about that. Yeah, so they're saying right now there could be about 6 to 10 different medicines that could actually fix this virus. Right now they're doing trials on animals and people, and so they're not really too sure about what's going on right now with those medicines, but they're saying hopefully within the next couple weeks to a month that we will be able to get a medicine that will in fact take this virus back out. Now they're saying that China is already going back to normal business. 95% of their businesses are back to normal. That is true for the most part, but right now they're saying that China just had another outbreak. So it's it's a really sad story because people are not paying attention. They're trying to make everyone stay apart. You have to stay 6 feet apart. This is only going to work if we have the social distancing, like they're saying. Now, in the US right now, there's over, I believe it's 40,000 cases. Like, that number jumped from a couple hundred just in a matter of 2 weeks. It jumped from a couple of hundred to 40,000, and it's still rising. People are buying tons and tons of sanitizer and tons of toilet paper. People are buying baby formula that don't have kids, and then they're going out and reselling it for quadruple the price. To whoever is doing those things, please stop, because there are people that need that stuff for their kids, that need that stuff to be able to go to the bathroom, to be able to feed their kids, to be able to get the everyday necessities that we need. Now, the government literally has put a damper on that, because now we have, they're making it to only where you can only buy a certain amount of those products. Now, that's when you know things are really bad, because people are literally taking this and trying to get it to their advantage, and then taking it and then trying to resell things for quadruple the price. Like, it makes absolutely no sense whatsoever. Right now, a big part of the reason why I wanted to make this other video is to simply let people know that by simply gargling warm water and all of the things that people are trying to do right now, to let people know that that is definitely one thing that does not work. It will not kill the virus. So please do not watch those type of things and try those things, because it has nothing to do with the virus whatsoever. Now, if you really want to do and get through this virus, we need to all start doing the social distancing. If you don't need to go to work, stay home. Don't go out. If you need to get food, if you need to get supplies, do so, but one person at a time. Things are getting really, really bad. Every day there's thousands and thousands of more cases that keep popping up, because of the simple fact that people are not paying attention to what the government is telling us to do. I'm just at a loss for words, because if we all did our part and listen to the government, I know a lot of us don't want to listen to the government, for the simple fact a lot of times the government doesn't help us in the ways that they should help us. And right now, they're trying to do everything that they can to make everything the correct way. Like, they're trying to do everything that they can to come up with a medicine and to make us stop going out and doing the things that we're doing to, and people, for the simple fact that they're saying that people don't know that they even have the virus and are giving it to other people. Now, people are literally, the virus can live in you and you can have no symptoms and go on your everyday life for the first 5 to 7 days, and then you can start getting symptoms. So by then it's already too late. This is why they're saying the social distancing you need to be able to do. So staying home every single day and not going out and getting over this virus, this is what we need to do as a nation. I right now we've over surpassed 410,000 cases of the coronavirus in just a matter of 3 months. 3 months. If we all just listen to the government, and I know a lot of people don't like the government, and for a lot of good reasons, but right now is one of the times we need to listen to them. To do everything that they're telling us to do, which is to stay home, stay 6 feet apart from one another unless you live with someone, self-quarantine. If you believe that you have it, you need to call the places that they're giving us to call and go get tested immediately, as soon as possible. Now, they're setting up places for everyone to do those things. They're setting up drive-through places. They're trying to get plenty of supplies out to people, face masks, gloves. Those are all things that we can do as a nation in order to get this virus contained. I really wanted to do this video because I've seen a lot of videos out there right now, and they're literally, in one of the videos is the water juggle thing, by putting warm water into your throat and juggling it for 30 seconds to a minute. That has nothing to do with the virus, and it won't do nothing for the virus. So if you want to know more about any of this stuff, please follow me, and please just keep paying attention to the news, listen to the radio, do whatever you gotta do, and do the social distancing. Stay home. If you're not essential for a working environment, don't go to work. There's no reason to go to work right now. Right now, the government has literally told banks, car loan companies, credit card companies, that you can get deferments on your car loans, meaning you can get them pushed back to a later time or on the end of your loan term. Mortgages, you can't be evicted right now. Sorry about that, guys, but yes, what they're telling us to do right now is to wash our hands regularly for 20 seconds with soap and water or alcohol-based hand rub, hand sanitizer. Cover your nose and mouth with a disposable tissue or flex elbow when you cough or sneeze. Avoid close contact, 1 meter or 3 feet, or even better, 6 feet, with people who are unwell. Stay home and self-isolate from others in the household if you feel unwell. Now, like I said, a lot of places are making videos and showing people things that you can do to get over this virus. Do not listen to certain things. If you want to know the real information, go online, go look it up on Google, watch the important videos and all of the live feed that is coming out from the government. They have all the up-to-date information about all of this and what you can be doing. on your part to get through this. Now, people that have underlying medical conditions and people that are older with age have a higher chance of getting this virus. This is what they're saying. Everyone can get it. There's been kids that get it. There's been young people that get it. So there's nobody that's immune to it. So all that we can do right now, as of today, is stay our distance from people, stay home. If you need to go out, get food, supplies, anything like that, send one person at a time to get those things. Wear a face mask, wear gloves. They're even saying that a lot of places aren't even accepting cash right now. I mean, that's most people's way of paying, so most places have to take it. But they're saying that's one thing that is very dirty, obviously. That is staying on surfaces, like it can stay on cardboard and all those things for up to a few hours to a day at a time. So this is just getting really, really crazy, and it's getting really bad. What we can do on our part is stay clean, stay healthy, and just listen and follow all the things that they're telling us to do. Right now, what we can do is listen to the government and do what they're suggesting, because at this moment in time, there's nothing much else that we can do until they come out with a cure. They're saying that this can go into the fall. It can literally last upwards of a couple months. It could last for the rest of the year. We don't know. That's why kids don't have school for the rest of the year, because we don't know how much longer this is going to last. Stock markets are going crazy. They're crashing. They're going back up. They're going down. People are losing millions and billions of dollars, all because of this viral disease or sickness, I should say. So what we need to do as a nation is wash our hands, wear gloves, wear face masks. If you're gonna go out, protect yourself. Stay 6 feet apart from each other. Hand sanitize, and just follow what the government's telling us to do right now until there's a cure. And hopefully this will go just like it has in China. China's back to 95% of their operations. And right now, we've already surpassed 400,000 cases in total in the world. And this has hit over 140 countries. And this is just going to keep getting worse if we don't do what we have to do as a nation and do everything that they're telling us to do. So I really hope that this video helps a lot of you, and I hope that you guys continue to watch me, and I really hope that we all get through this, and as a country we will. We've prevailed through all of the other sicknesses, through all of the other pandemics, and we will get through this, guys. We will. So everyone, stay safe, protect yourself, wash your hands, sanitize, and keep watching, guys. Stay tuned. Thanks. They're also saying that people with the virus is generally develop signs and symptoms, including mild respiratory symptoms and fever, on an average of 5 to 6 days after infection. So it means incubation period 5 to 6 days, range from 1 to 14 days. Most people infected with the virus have mild disease and recover. So there's already been a total of around, I believe it's around 10,000 10,000 or more deaths so far, and it's just going to continue to rise. It's going to continue to rise because people aren't doing the social distancing. We need to spread apart. We need to listen to what the government is telling us to do, guys. We have to. The virus, it's not certain how long the virus that causes this survives on surfaces, but it seems to behave like other coronaviruses. Studies suggest that coronaviruses, including preliminary information, may persist on surfaces for a few hours or up to several days. Now, let's see what else they're saying right now. What schools should do during an outbreak of the disease is urging schools, whether open or helping students through remote learning, to provide students with holistic support. Schools should provide children with vital information on hand washing and other measures to protect themselves and their families, facilitate mental health support, and help to prevent stigma and discrimination by encouraging students to be kind to each other and avoid stereotypes when talking about the virus. How can I care for a family member with the coronavirus disease at home? Avoid sharing personal items like food and drinks. Provide your sick household member with clean, disposable face masks to wear at home, if available, to help prevent spreading the coronavirus to others. Clean the sick room and bathroom as needed to avoid unnecessary contact with the sick person. Who is most at risk? People of all ages can be infected by the new coronavirus. Older people and people with pre-existing medical conditions such as asthma, diabetes, heart disease appear to be more vulnerable to becoming severely ill with the virus. WHO advises people of all ages to take steps to protect themselves from the virus. For example, by following good hand hygiene and good respiratory hygiene. So that means wash your hands, hand sanitize, wash your face, don't touch your face with dirty hands. Don't go around touching things all over the place, like when you're at the store and all that stuff, and then touching your face and doing all that stuff. Take a shower. If you don't take a shower twice a day, try to. These are all things that we can do to better prevent this from spreading. They're trying everything in their power right now to find a specific medicine to overcome this, and they're saying that there are a few medicines that we already have today in modern medicine that could help this go away, but they're not 100% sure. So right now they're doing all sorts of testing. They're testing on, from what I've heard, animals. They're doing human trials and all that stuff right now. I'm not really sure how accurate all that information is, but from the things that I've been reading, from the things that I've been hearing, I've been watching the news, listening to the radio, and these are all things that I keep hearing and seeing. How long should I stay in home isolation if you have the corona disease? Stay at home until instructed to leave. Patients with confirmed coronavirus should remain under home isolation precautions until the risk of secondary transmission to others is thought to be low. Talk to your healthcare provider. The decision to discontinue home isolation precautions should be made on a case-by-case basis in consultation with healthcare providers and state and local health departments. Right now, in New York alone, there's over 15,000 cases, and we've already surpassed Italy very, very quickly, and that's just New York alone. So, this virus is getting very, very bad, and we can do a lot on our ends to help prevent this to keep spreading. They're saying if you believe that you have the virus, not to just run and get up and go to the hospital, to the nearest hospital, because of the risk of spreading it. So what a lot of doctors and everything are doing now, they're doing everything online. They're doing it through video chats, through Zoom, through Facebook. They're doing all sorts of things that you can find out by going online or on your phone. And but yeah, a lot of places, a lot of doctors are screening patients through phone access like this, like video chat. So that's one way to be able to, excuse me guys, that's one way to be able to talk to a doctor and let them know your symptoms and all that good stuff. Well, not good stuff, sorry. Let them know all of that stuff, so that way you can let them know what's going on with you, and they can give you the right diagnosis, basically. Now, how do you disinfect surfaces for the coronavirus? For disinfection, diluted household bleach solutions, alcohol solutions with at least 70% alcohol, and most common EPA registered household disinfectants should be effective. Should I have contact with my pet if I have the coronavirus? When possible, have another member of your household care for your animals while you are sick. If you are sick with coronavirus, avoid contact with your pet, including petting, snuggling, being kissed or licked, and sharing food. If you must care for your pet or be around animals while you are sick, wash your hands before and after you interact with pets, and wear a face mask at all times. What are the symptoms of the coronavirus? The most common symptoms are fever, cough, shortness of breath, breathing difficulties. In more severe cases, infection can cause pneumonia, severe acute respiratory syndrome, and even death. The period within which the symptoms would appear is 2 to 14 days. Now, you might not know that you have it because some symptoms don't show for the first 4 to 8 days. So you not knowing that you potentially have it, you could be giving it to somebody else, walking around, giving it to your family member, to anything like that. So if you start feeling any sort of symptoms, just be 100% careful and go to your nearest, go online, check what you can do, watch my videos, and hopefully some of my information will help a lot of these people and a lot of you guys to help get through this. Who should be tested for the coronavirus? Your doctor will determine if you have signs and symptoms of corona and whether you should be tested. In the early stages of infection, it is possible the virus will not be detected. A negative test result for a sample collected while a person has symptoms likely means that coronavirus is not causing their current illness. Like I said, they're starting to set up a lot of like hospital type things in schools. They're setting them up in all sorts of parts of the states. So you have to go online and find out where those direct places are. They have drive-up places where you can go and get tested. A lot of these tests are coming back within a couple of hours. So most people are finding out if they are, in fact, do have the virus or if they don't. Which is good and it's not good at the same time, but it's definitely good because then you will know if you have it. And at the moment, they're running out of tests because the virus is going extremely fast because people are not staying home, people are running outdoors, people are they're basically not listening to what the government is telling us to do, which is to stay quarantining, stay home. If you don't need to go to work, don't go to work. If you're not an essential employee like a cop or a doctor, we need to stay home and we need to quarantine. Social distancing right now is the thing that is going to make this, it's gonna make it shrink. It's not gonna keep expanding. It's expanding right now because people are not listening to what are being said from the government. How can you prevent the spread of the coronavirus? Wash your hands often with soap and water for at least 20 seconds after blowing your nose, coughing, sneezing, going to the bathroom, and before eating or preparing food. Avoid touching your eyes, nose, mouth with unwashed hands. Stay home when you are sick. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. All things that we should already know what to do, but a lot of people don't do those things. Can you contract the coronavirus disease by touching a surface? People could catch the virus by touching contaminated surfaces or objects and then touching their eyes, nose, or mouth. That is why it's important to always hand sanitize. Keep a little bottle of hand sanitizer with you. Keep washing your hands, wash your face, keep your hygiene up. Wash your body 2 times a day if you have to. These are all things that are going to prevent you from getting sick and preventing other people from getting sick. Or it's going to help, basically, it's going to consolidate this spread. What are the emergency warning signs for someone with a coronavirus? Difficulty breathing or shortness of breath, persistent pain or pressure in the chest, new confusion or inability to arouse, bluish lips or face. This list is not all inclusive. Please consult your medical provider for any other symptoms that are severe or concerning. So not all those things could be symptoms that you're having. So contact someone in the medical field right away if you believe that you have it. Now, they're asking, is the coronavirus disease new? COVID-19 is a new strain that was discovered in 2019 and has not been previously identified in humans. Can the coronavirus disease spread through food? Current evidence on the other coronavirus strains show that while coronaviruses appear to be stable at low and freezing temperatures for a certain period, food hygiene and good food safety practices can prevent their transmission through food. What is a mass gathering? An event counts as a mass gathering if the number of people it brings together is so large that it has the potential to strain the planning and response to resources of the health system in the community where it takes place. Is the coronavirus disease more severe than the flu? COVID-19 causes more severe disease than seasonal influenza. While many people globally have built up immunity to seasonal flu strains, coronavirus is a new virus to which no one has immunity. That means more people are susceptible to infection and some will suffer severe disease. Globally, about 3.4% of reported COVID-19 cases have died. By comparison, seasonal flu generally kills far fewer than 1% of those infected. Can babies get the coronavirus disease? We know it is possible for people of any age to be infected with the virus, but so far there are relatively few cases of coronavirus reported among children. But that doesn't mean that they can't get it. There have been cases where there has been a couple cases that have been reported that kids have gotten it. So let's do everything that we can, guys, to make this disease go away. And we can, as long as everybody works together and we self-quarantine quarantine and we do the social distancing and we hand sanitize, we hand wash, we wash our face, we keep our hygiene up, we do all of the things that the government is telling us to do right now. We need to really take control right now and do the things that they're telling us to do. And if we don't, it's just going to keep spreading. Things are going to keep getting worse, and we're never going to get through this. But we can, guys. We have prevailed through every other disease, every other sickness in our world. In our world's history, we have gotten through everything. We will get through this, guys. We will get through it.